Welcome to the Deep Dive. Today we're going deep on antibiotic stewardship.
Yeah.
And whether you're a student getting ready for those big exams,
Yeah.
or a clinician or pharmacist working on stewardship initiatives, or you're a leader tasked with actually putting these programs into place, this deep dive is for you.
It can be a little bit dry.
Yeah.
But trust me, when we kind of unpack the impact of antibiotic stewardship,
Right.
you'll see how crucial this is.
Okay, I know antibiotic stewardship
Yeah.
doesn't exactly sound like a day at the beach.
Right.
But think of it this way. Antibiotics are a precious resource.
Yeah.
It's kind of like that last slice of pizza,
Exactly.
We got to make sure that we're not wasting them so they're there when we really, really need them.
Right.
And that's where stewardship comes in, using antibiotics wisely to keep them working.
Exactly. The CDC defines antibiotic stewardship as a set of commitments and activities designed to optimize the treatment of infections while reducing the adverse events associated with antibiotic use. So it's not just using less, it's about using them smarter.
Okay, we've got some great resources lined up today from the CDC and the Joint Commission
Awesome.
to guide us. And to make things a little bit more interactive, we're going to be sprinkling in some multiple choice questions.
Love it.
Think of it as a little mini review session.
Yeah.
No pressure.
Exactly.
Okay. Ready to dive in?
Let's do it.
All right. First question. What percentage of outpatient antibiotics are prescribed in primary care settings in the U.S.?
Okay.
So think about, going to your family doctor
Right.
for a cough or a sore throat. Take a moment to consider your answer.
All right.
I'm going to give you the options in a second.
It might surprise you.
All right. Here are your choices.
Right.
A, 10%,
Right.
25% C,
Okay.
50%, 75%?
Okay.
All right. Time's up. What did you land on?
The answer is C. 50%.
50%?
50%. According to the CDC, 50% of outpatient antibiotics come from primary care settings.
Wow.
Family practice, pediatrics, internal medicine.
Wow. 50%. That really underscores why antibiotic stewardship efforts in primary care are so important.
Absolutely. Imagine the potential impact if we could just optimize a fraction of those prescriptions.
Absolutely. Okay, ready for question number 2?
Hit me.
This one's a little bit more conceptual. Which of the following is not a core element of outpatient antibiotic stewardship?
Okay.
Think about the big picture. What's at the heart of effective stewardship?
All right.
Okay, here are your options. A, commitment. B, action. C, restriction and preauthorization. D, education and expertise.
Okay.
What did you choose, and more importantly, why?
So the correct answer is C, restriction and preauthorization.
Restriction and preauthorization.
While those are sometimes used, especially in hospitals, they're not core elements of outpatient stewardship programs.
Gotcha. Okay, so if those aren't the core pieces, what is? The CDC outlines 4 key elements. The first is commitment.
Right. So this means fostering a culture where everyone is dedicated to appropriate antibiotic use.
Exactly.
From clinicians to, making public commitments to consistent messaging from staff.
Right.
It all starts with everyone being on board.
Yeah, setting the stage for success.
Absolutely. Then there's action for policy and practice. So this is about putting those commitments into practice.
Right.
This could involve things like implementing guidelines, promoting delayed prescribing, and using clear diagnostic criteria.
Exactly.
So really making sure that those antibiotics are only being used when they're necessary.
Moving from words to action.
Yes.
Translating those good intentions into tangible changes.
Love it. Then there's tracking and reporting.
Yes.
You can't improve what you don't measure right.
Exactly.
So this is all about monitoring those prescribing practices, measuring the impact of the interventions that we're putting into place,
Right.
and using data to figure out where we can do even better. It's all about being data-driven, using information to guide our efforts.
Absolutely. And last but not least, there's education and expertise.
Super important.
This is about making sure that both clinicians and patients have the knowledge that they need to make smart decisions
Right.
about antibiotics. So think educational resources training on how to communicate effectively about antibiotics.
Yes.
And access to experts who can provide guidance.
It's a two-way street, empowering both the providers and the patients to be informed participants.
Okay, ready for a slightly more technical question.
Hit me.
What is the standardized antimicrobial administration ratio, or SAR for short?
Oh, the SAR.
The SAR. Again, I'll give you a moment to think before I throw these options at you.
This one's all about how we measure antibiotic use in hospitals.
Here we go. A measure of antibiotic resistance in a hospital. B, a risk-adjusted benchmark of antibiotic use in a hospital. C, a measure of the financial impact of antibiotic stewardship programs. D, a tool for tracking antibiotic prescribing practices of individual physicians.
Right.
All right, time's up. What's your best guess?
The correct answer is B, a risk-adjusted benchmark of antibiotic use in a hospital.
A risk-adjusted benchmark.
Yes.
Okay.
Now, that might sound a little jargony. So hospitals are all different sizes. They treat different types of patients.
Sure.
Some hospitals handle more complex cases than others.
Right.
So if we just looked at how many antibiotics each hospital uses, it wouldn't be a fair comparison.
It's like comparing apples and oranges.
Exactly. The SAR takes those factors into account, so it's a way to compare antibiotic use across hospitals in a way that's actually meaningful.
Right.
A higher SAR means the hospital's using more antibiotics than expected,
Gotcha.
based on its specific characteristics.
So a highest SAR isn't necessarily a bad thing, but it could be a sign that there's room for improvement.
It's just a flag that prompts us to look deeper and see if there are opportunities to optimize.
And that's where those core elements that we talked about, the commitment, the action, the tracking, the education come in.
Yeah.
Those are the tools that can help hospitals bring that SAR down and use antibiotics more judiciously.
Absolutely.
All right, one last question before we move on to some deeper discussion.
All right.
This one comes from the 2019 update to the core elements of hospital antibiotic stewardship programs. Think about leadership commitment. Which of the following is not considered a top priority example of showing that commitment?
Ooh.
Give it some thought.
All right.
I'll reveal the choices soon.
This is about how hospital leaders can demonstrate that antibiotic stewardship is truly a priority.
All right, here are your options.
Yeah.
A, appointing a senior executive leader to champion the stewardship program. B, integrating antibiotic stewardship into sepsis management efforts. C, providing dedicated time for stewardship program leaders. D, regularly reporting stewardship activities and outcomes to senior leadership and the hospital board.
Okay.
What did you choose, and what clues from our conversation led you to that answer?
The correct answer is B, integrating antibiotic stewardship into sepsis management efforts.
Integrating antibiotic stewardship.
While aligning stewardship with other quality initiatives like sepsis management is good,
Yeah.
the 2019 update specifically calls out other priorities as more critical demonstrations of leadership commitment.
Gotcha. So, for example, C, providing dedicated time for those running the stewardship program.
Yes.
That's crucial. We can't expect them to,
Wave a magic wand.
wave a magic wand and improve things if they're juggling a million other tasks and have zero time to focus on this.
It's about recognizing that stewardship work takes time and effort.
Yes.
Protected time allows leaders to manage the program, analyze data, and drive those interventions.
Absolutely.
Yeah.
And D, regularly reporting those activities and outcomes to the top brass is key for accountability and transparency.
Yes.
That shows that leadership is actively engaged and invested in the program's success.
It's like keeping everyone informed, showcasing the impact.
Exactly.
Regular reporting helps advocate for continued support.
Absolutely. And of course, A, having a designated champion at the executive level is a powerful signal of commitment.
Having a cheerleader in the boardroom
Yeah.
who's constantly advocating.
Absolutely. So the key takeaway here is that actions speak louder than words.
Yes.
Dedicating those resources,
Yeah.
reporting that progress, and having a visible champion at the top are all powerful ways for hospitals to demonstrate that stewardship is more than just a buzzword. It's a core value.
I love that.
So we've seen how important leadership commitment is at the hospital level. But let's zoom in on some of the specifics of how these programs actually work. We touched on outpatient settings,
Right.
but the CDC's core elements of outpatient antibiotic stewardship document actually outlines a wide range of entities
Yeah.
that should be involved in these efforts.
It's a much broader scope than
Yeah.
a lot of people realize. We're
Yeah.
talking family practices,
Wow.
pediatricians, nurse practitioners, PAs.
Yeah,
It really highlights how stewardship is relevant across the entire spectrum of outpatient care.
absolutely.
Yeah.
And it's not just about individual clinicians. The CDC also emphasizes the role of entire healthcare systems in promoting appropriate antibiotic use.
Right.
It's a team effort.
Absolutely.
And the more coordinated we are, the better the outcomes.
What I find so fascinating is the documents focus on what they call high priority conditions.
Okay.
These are situations where inappropriate antibiotic prescribing is particularly common.
Gotcha.
Think about those times you go to the doctor,
Right.
with a cough, sore throat, or sinus issues.
Mm-hmm.
Those are some prime examples.
Yeah, those are the classic cases where sometimes antibiotics are prescribed even when they might not be necessary. We've all been there.
Right.
The CDC specifically calls out acute bronchitis, viral pharyngitis, which is basically a sore throat, and sinusitis as areas where we need to be extra careful.
It's about recognizing that many of these conditions are often caused by viruses which antibiotics can't treat.
Right.
Or they might get better on their own with time and supportive care. Overprescribing in these situations not only doesn't help the patient, but also contributes to the bigger problem of antibiotic resistance.
And it's not just about overprescribing, right? Sometimes the wrong antibiotic is prescribed or the dose or the duration is incorrect.
Right.
So there are multiple ways things can go awry.
The document gives a great example of zithromycin
Okay.
being prescribed for acute sinusitis when amoxicillin or amoxicillin clavulinate
Okay.
would be more appropriate choices.
Right.
It's a nuance that might seem small, but it highlights the importance of having clear, evidence-based guidelines to guide prescribers.
So you're saying it's not just about knowing when to use antibiotics, it's also about which antibiotics to use and for how long.
Exactly. It's a multifaceted challenge, and it really underscores the need for clear communication, collaboration, and a commitment to staying up to date on best practices.
Speaking of collaboration,
Yes.
the CDC document also emphasizes the importance of partnerships between outpatient facilities and hospitals.
Right.
I guess that makes sense. A lot of patients move back and forth
Exactly.
between those settings.
It's all about continuity of care.
Right.
Imagine a patient being discharged from the hospital after being treated for pneumonia. If their primary care doctor isn't in the loop about the specific antibiotics they received,
Right.
there's a risk of duplicate testing, unnecessary prescriptions, or even gaps in treatment.
And tersin. So good stewardship isn't just about what happens within the walls of a single facility.
Right.
It's about coordinating care across the entire healthcare system.
Precisely. And that collaboration can take many forms.
Okay.
Hospitals and outpatient clinics can work together to monitor local resistance patterns, share information about prescribing practices, and make sure patient transitions are smooth and seamless.
One of the things that really stood out to me from the CDC document was this emphasis on the human element of antibiotic stewardship.
Oh, I love this.
It's not just about the science.
Right.
It's about people and relationships.
Yeah, you're absolutely right. The document highlights how important it is to foster a culture of commitment, communication, and collaboration.
Absolutely.
It's about getting everyone on the same page, from clinicians to nurses to pharmacists to patients themselves.
And speaking of patients, one example that really stood out to me was this study where clinicians put up posters in their exam rooms with a letter committing to appropriate prescribing.
I love that.
I thought that was so smart.
It's such a simple but powerful way to signal to patients that you're taking this seriously.
Yeah.
And it can open the door to a conversation about why antibiotics aren't always the best course of action.
I think sometimes patients feel pressure to ask for antibiotics or they worry that their doctor won't take them seriously if they don't.
Exactly.
So seeing that kind of commitment displayed openly can really help put everyone at ease.
It's about building trust and understanding. When patients feel heard and informed, they're more likely to be partners in the decision-making process.
Absolutely. Okay, let's shift gears a bit and take a closer look at the hospital side of things.
Yeah.
We've got some great insights from the Joint Commission's R3 report on the new and revised requirements for antibiotic stewardship that went into effect at the beginning of 2023.
These updates really reflect how the field of antibiotic stewardship is evolving, and they provide a roadmap for hospitals to enhance their programs.
Now, before we dive into the updates, though, I think it's important to take a step back and just remember the sheer magnitude of the problem that we're facing. The report cites some pretty sobering statistics from the CDC. Are you ready for this?
Hit me.
At least 2.8 million antibiotic-resistant infections occur in the U.S. each year, leading to over 35,000 deaths.
Those numbers are staggering.
It's a lot.
And when you add in C. diff infections, which are often linked to antibiotic use, the numbers jump to over 3 million infections and 48,000 deaths.
That's a lot of people.
That's a lot of people. All right, let's get into those updates from the Joint Commission. One of the big changes is the emphasis on resource allocation.
Okay.
The report states that hospitals have to actually put their money where their mouth is and dedicate financial resources for staffing and IT to support those programs.
I see this as a huge win for stewardship.
Yeah.
For so long, these programs have been run by dedicated individuals who are passionate about the issue,
Right.
but often without the necessary resources to truly make a difference.
Right.
This update recognizes that stewardship is a patient safety priority that deserves investment.
It's about putting actions behind words, right?
Yeah, same.
Saying you're committed to stewardship is great,
Yeah.
but actually allocating the funds to hire dedicated staff, to train those staff,
Yes.
and implement the necessary technology, that's what truly shows commitment.
I love it. Another significant update is related to leadership.
Okay.
The report states that the hospital's governing body now has to appoint a physician and/or pharmacist.
As the leader or leaders of the program.
Gotcha.
And this appointment has to be based on recommendations from the medical staff leadership and the pharmacy leadership.
So it's not just about picking someone at random. It's about ensuring that the people at the helm have the right expertise and the backing of their colleagues.
We're talking about individuals with specialized education training or experience in infectious diseases and your antibiotic stewardship.
Right.
They need to be able to develop and implement strategies, analyze data, provide guidance to prescribers, and really champion the program within the hospital.
It's like having a dedicated team of experts
Yes.
who are passionate about the issue
Yes.
and equipped to make a real impact.
The Joint Commission also highlights the importance of a multidisciplinary committee to oversee the stewardship program.
Okay.
This committee needs to include folks from all sorts of departments,
Right.
medical staff, pharmacy, infection prevention, nursing, microbiology, IT,
Wow.
even the quality improvement team.
Wow, that's quite the team.
It is.
What's the rationale for having such a diverse group involved?
It's all about recognizing that antibiotic stewardship touches every corner of the hospital.
Right.
Having representation from all these different areas ensures a holistic approach that takes into account the unique perspectives and challenges of each department.
It's about breaking down those silos and fostering a sense of shared responsibility.
Yes.
Everyone has a role to play.
Absolutely. And speaking of using antibiotics wisely,
Yes.
the report also dives into some specific strategies
Okay.
that hospitals should be using to optimize prescribing practices.
Okay.
Two key strategies they highlight are preauthorization
Hmm.
and prospective review and feedback.
We touched on preauthorization earlier,
Right.
but can you remind us how it works in the hospital setting?
Sure. So preauthorization basically means that clinicians have to get approval from the stewardship team
Okay.
before they can prescribe certain antibiotics.
Okay.
This helps ensure that those antibiotics are only being used when they're truly necessary, particularly for those that are prone to resistance or have a higher risk of side effects.
It adds an extra layer of scrutiny
Right.
and helps to guide those prescribing decisions.
Absolutely. Now, prospective review and feedback is a slightly different approach.
Okay.
It involves a member of the stewardship team reviewing antibiotic prescriptions after they've been written
Okay.
and then providing feedback to the prescriber.
So it's like having a second set of expert eyes
Yes.
on every prescription.
Exactly.
Ah.
And during that review, the stewardship team member might suggest modifications to the prescription,
Okay.
like changing the antibiotic,
Mm-hmm.
adjusting the dose, or shortening the duration of therapy.
So it's a more collaborative approach, right? It's
Yeah.
not about saying no to antibiotics altogether. It's about working together
Right.
to ensure that they're being used in the most optimal way.
The Joint Commission report also emphasizes the importance of having clear evidence-based guidelines to guide prescribing. They specifically state that hospitals need to implement at least 2 evidence-based guidelines to improve antibiotic use for the most common indications.
I'm guessing those common indications are things like pneumonia, UTIs, skin infections.
Yeah,
Those bread and butter cases that hospitals see all the time.
you're right. The report actually lists them out. Community-acquired pneumonia, urinary tract infections, skin and soft tissue infections, C. diff colitis, and surgical prophylactic antibiotics.
Wow, okay. So
Nothing.
are hospitals expected to just adopt those national guidelines word for word, or is there some flexibility?
There's definitely some room for customization.
Okay.
The report specifically states that these guidelines need to be based on national recommendations, but they should also reflect the local context.
What does that mean exactly? Local context.
It means taking into account things like the specific bacteria that are circulating in your community, the antibiotics that are available on your hospital's formulary, and the types of patients your hospital serves.
Gotcha.
It's about tailoring those national guidelines to fit your unique situation.
That makes sense.
Yeah.
What works in one place might not work in another.
Right.
It's about being adaptable and using those guidelines as a starting point rather than a rigid rule book.
One of the notes in the report that caught my eye was about the importance of monitoring antibiotic use. It's not enough to just implement these programs and hope for the best.
Right.
We need to track what's happening and see if our efforts are making a difference.
Data is power. If we're not measuring our progress, we're just flying blind. What kind of monitoring does the Joint Commission recommend?
They suggest analyzing data on days of therapy per 1,000 days present,
Okay.
or 1,000 patient days, or reporting antibiotic use data to the CDC's National Healthcare Safety Network.
Okay, I'm going to need you to break that down for me. What do those metrics actually tell us?
Basically, they're ways to track how much antibiotics are being used
Yeah.
and to see if that use is going up or down over time.
Gotcha.
It allows hospitals to compare themselves to national benchmarks and to identify areas where they might be using more antibiotics than necessary.
So it's not just about collecting data for the sake of collecting data. It's about using that information to drive improvement.
Exactly. The report also stresses the importance of reporting that data back to hospital leadership and prescribers.
Right.
This helps create a culture of transparency and accountability, and it allows the hospital to track the program's progress,
Right.
identify opportunities for improvement,
Yeah.
and showcase the value of the program.
It's about closing the loop and making sure that the data we collect is actually being used to inform decision-making
Right.
and drive change.
All these updates from the Joint Commission really reflect a growing recognition that antibiotic stewardship is crucial for protecting patients, preserving the effectiveness of these vital medications, and combating the threat of antibiotic resistance.
Now, we've talked a lot about the Joint Commission's perspective, but let's also take a look at what the CDC has to say about hospital stewardship.
Right.
Their core elements of hospital antibiotic stewardship programs dives even deeper into the nuts and bolts of building successful programs.
The CDC document really hammers home the point that leadership commitment is the foundation of any successful stewardship program.
Right.
Without buy-in from the top,
Mm-hmm.
even the best designed programs will struggle.
It goes back to what we were saying earlier about action speaking louder than words.
Exactly.
It's great to have a mission statement about stewardship,
Right.
but it's the allocation of resources,
Yeah.
the appointment of dedicated leaders,
Right.
and the ongoing support from hospital administration.
Yeah.
That really makes the difference.
The CDC highlights the importance of dedicating both human and financial resources
Right.
to these programs.
Absolutely.
This includes providing dedicated time for program leaders to manage the program, conduct interventions, analyze data, and basically do the work that needs to be done.
It's about recognizing that stewardship isn't just an extra task on someone's already overflowing to-do list.
Right.
It requires dedicated time, effort, and expertise.
Yeah. And speaking of expertise, the CDC strongly recommends a co-leadership model
Okay.
for these programs, with a physician and a pharmacist working together to lead the charge.
I can see how that partnership would be beneficial.
Right.
Physicians bring their clinical knowledge and experience treating infections,
Yes.
while pharmacists have that deep understanding of medications,
Right.
dosing side effects,
Yes.
and resistance patterns.
It's a powerful combination.
Yeah.
The pharmacist can really be that go-to resource for prescribers, providing guidance on appropriate antibiotic choices,
Right.
dosing regimens, and duration of therapy.
The CDC document also delves into some specific interventions
Yeah.
that hospitals can use to improve antibiotic prescribing. They categorize these interventions into priority interventions and other interventions.
The priority interventions are those that they consider to be the most impactful
Okay.
and the most feasible to implement across a wide range of hospitals.
Okay. Let's unpack those priority interventions. What are they and how do they work?
So the first one is prospective audit and feedback, which we've already touched on.
Right.
Remember, this involves a member of the stewardship team reviewing antibiotic prescriptions after they've been written and providing feedback to the prescriber.
So it's that collaborative approach where the stewardship team acts as a resource to help guide those prescribing decisions.
The second priority intervention is preauthorization,
Right.
which we've also discussed. This is about requiring approval before certain antibiotics can be prescribed, helping to ensure that those antibiotics are only used when they're truly necessary.
Gotcha. And the third priority intervention is the development of facility-specific treatment recommendations.
That's right. These recommendations provide clear guidance on what antibiotics should be used for specific infections, taking into account the local context that we discussed earlier.
So it's about tailoring those national guidelines to fit the specific needs of each hospital and ensuring that everyone is on the same page
Right.
about how to treat common infections.
All right.
Now, the CDC document also acknowledges that there's no one-size-fits-all approach to stewardship.
Right.
Different hospitals will face different challenges
Sure.
and have different resources available.
Right.
So they also offer a range of other interventions that hospitals can consider implementing.
Okay. I'm curious to hear about some of those other interventions. What are some examples?
Well, one example is what they call antibiotic timeouts.
Okay.
Have you heard of those?
I have, but I'm not sure I fully understand how they work. Can you explain?
Yeah, so an antibiotic timeout is basically a pause in treatment
Okay.
where the prescriber reassesses the need for the antibiotic.
Okay.
It usually happens after a certain period of time,
Okay.
like 48 or 72 hours, or when new information becomes available,
Sure.
like culture results. So it's like a check-in point to make
Yeah.
sure that the antibiotic is still necessary and to see if any adjustments need to be made.
Exactly.
Wow.
And while the CDC acknowledges that antibiotic timeouts can be helpful, they also caution that they shouldn't be the only stewardship intervention in place.
Right.
They suggest that prospective audit and feedback,
Right.
which is conducted by the stewardship team, is a more comprehensive and effective way to optimize antibiotic use.
That makes sense. Having that expert review from the stewardship team adds an extra layer of scrutiny
Yes.
and helps ensure that those timeouts are being used appropriately and effectively.
The CDC also provides a helpful table outlining key opportunities
Okay.
to improve antibiotic use for common infections. They break it down by infection type and provide specific recommendations for how to optimize prescribing.
I'm always a fan of concrete, actionable recommendations.
Yeah.
Let's dive into some of those recommendations. What do they suggest for, say, urinary tract infections?
Yeah.
Those are incredibly common, so I imagine there's a lot of room for improvement there.
For UTIs, they emphasize the importance of using clear criteria
Okay.
for deciding when to order urine cultures, distinguishing between asymptomatic and symptomatic bacteriuria,
Okay.
and using the shortest duration of antibiotic therapy that's clinically appropriate.
Okay, let's unpack that a bit. Why is it so important to have criteria for urine cultures?
Because not everyone who has bacteria in their urine needs antibiotics.
Right.
Asymptomatic bacteriuria, for example, is a condition where bacteria are present in the urine, but the person isn't showing any symptoms of infection.
Gotcha.
In many cases, treating asymptomatic bacteriuria with antibiotics doesn't provide any benefit and can actually increase the risk of complications.
So it's about being more selective and only treating those who are actually experiencing symptoms.
Exactly. And when antibiotics are indicated for UTIs, it's important to choose the right antibiotic
Right.
and use it for the shortest duration possible to minimize the risk of resistance and side effects.
What about skin and soft tissue infections?
Yeah.
Those are another common reason for antibiotic prescriptions.
Right.
What guidance does the CDC offer there?
For skin infections, the CDC recommends developing clear diagnostic criteria to differentiate between different types and severities of infections.
Because not all skin infections are created equal.
Exactly. Some skin infections, like mild cellulitis, might respond well to topical antibiotics, while others, like severe necrotizing fasciitis, require aggressive intravenous antibiotics.
Wow, okay.
It's all about tailoring the treatment to the specific infection.
And how do we ensure that the right antibiotics are being used from the start?
The CDC recommends ensuring appropriate empiric therapy, which means choosing an antibiotic that's likely to be effective based on the suspected bacteria and the patient's clinical presentation.
So it's about making an educated guess based on the available information and then adjusting the treatment as needed once those culture results are available.
Exactly. And once those culture results are in, the CDC stresses the importance of tailoring the definitive therapy. Based on those results, ensuring that the patient is receiving the most effective antibiotic for their specific infection.
What other areas does the CDC table address?
It also provides guidance on surgical prophylactic antibiotics, which are antibiotics given to prevent infections after surgery.
Those are important because infections can be a serious complication after surgery. But I imagine there's also risk of overusing prophylactic antibiotics.
That's why the CDC emphasizes the importance of using the right antibiotic at the right dose and for the right duration. They stress that prophylactic antibiotics should be stopped within 24 hours after surgery in most cases.
So it's about using them strategically to prevent infections,
Right.
but also being mindful of the potential downsides of overuse.
The CDC document also goes beyond those priority interventions and delves into a wide range of other strategies that hospitals can consider implementing.
Okay, I'm intrigued. Let's hear about some of those other interventions.
Well, one area they focus on is sepsis.
Okay.
Sepsis is a life-threatening condition that occurs when the body's response to infection goes into overdrive.
It's a very serious condition, and antibiotics are a crucial part of treatment.
Yes.
But I imagine there's also a risk of overuse, especially in those initial stages when the diagnosis might not be clear-cut.
That's right. The CDC suggests developing antibiotic recommendations for sepsis that are based on local microbiology data, ensuring protocols are in place to administer antibiotic quickly in suspected cases of sepsis, and having mechanisms in place to review antibiotics started for sepsis so that therapy can be tailored or stopped if deemed unnecessary.
So it's about striking that balance between acting quickly to treat a potentially life-threatening condition.
Right.
And being judicious about antibiotic use to prevent resistance and other harms.
Exactly. Another area they suggest focusing on is Staph aureus infections.
Oh, okay.
Staph aureus is a type of bacteria that can cause a wide range of infections, from skin infections to pneumonia to bloodstream infections.
And some strains of Staph aureus, like MRSA, are resistant to multiple antibiotics,
Yes.
making treatment much more challenging.
That's right. The CDC points out that in many cases, therapy for MRSA can be stopped if the patient doesn't actually have an MRSA infection,
Okay.
or it can be changed to a more appropriate antibiotic if the cause is not MRSA.
Right.
They also suggest that hospitals implement protocols
Yeah.
and, if available, infectious diseases consultations to improve outcomes in patients with Staph aureus bloodstream infections.
So it's about having those systems in place to ensure that the right antibiotic is being used for the right infection.
Right.
And that therapy is being de-escalated as soon as possible.
Yes.
To minimize the risk of resistance.
Now, all these interventions are great, but if you're not tracking what's happening, you have no way of knowing if they're actually working.
Right.
That's why the CDC stresses the importance of monitoring and evaluating antibiotic use and outcomes.
Measurement is key. If you can't measure it, you can't manage it right. What kind of tracking does the CDC recommend for hospitals?
They stress the importance of electronically reporting antibiotic use data to the National Healthcare Safety Network, specifically the antimicrobial use option. This allows hospitals to track their own antibiotic use,
Right.
benchmark themselves against national data,
Okay.
and see how their use is changing over time.
It's about having that bird's eye view of antibiotic use within the hospital.
Right.
And being able to identify trends and areas for improvement.
And they don't just recommend tracking antibiotic use. They also highlight the importance of monitoring other outcomes related to antibiotic use,
Okay.
like C. diff infections and resistance patterns.
We talked about C. diff earlier. It's a nasty infection that can be a serious complication of antibiotic use.
Exactly. The CDC encourages hospitals to track their C. diff infection rates and to look for any potential links to antibiotic use.
Because if you see a spike in C. diff cases,
Right.
that could be a red flag
Yeah,
that your antibiotic prescribing practices need some tweaking.
exactly. And the CDC also recommends monitoring resistance patterns for key pathogens.
Okay.
Keeping tabs on how those bacteria are evolving and adapting to the antibiotics we use to treat them.
It's like an arms race between us and the bacteria.
It is.
The more we use antibiotics,
Right.
the more pressure we put on them to evolve resistance.
Yeah.
So we need to be vigilant and constantly monitoring how they're changing so we can stay one step ahead.
The CDC document also provides a helpful table outlining specific process measures
Okay.
for quality improvement.
Process measures, remind me what those are again?
Sure. Process measures focus on how the stewardship program is being implemented
Okay.
rather than on the ultimate outcomes.
Gotcha.
They help you assess whether the program is working as intended
Okay.
and identify areas where things could be improved.
So it's about looking under the hood and making sure all the gears are turning smoothly. Give me an example of a process measure related to stewardship.
One example is tracking the types and acceptance of recommendations
Okay.
from those prospective audit and feedback interventions we talked about earlier.
So if the stewardship team recommends a change to an antibiotic prescription,
Right.
are they tracking whether the prescriber actually accepts and implements that recommendation?
Exactly. This can help identify areas where there might be resistance to the program or where more education is needed.
It's about making sure that the stewardship team's recommendations aren't just falling on deaf ears.
Right.
They need to be heard, understood, and acted upon.
Another suggestion is to monitor adherence to those facility-specific treatment guidelines. Are clinicians actually following the recommendations that have been laid out?
It's all about accountability and
Yeah.
ensuring that those guidelines aren't just sitting on a shelf somewhere gathering dust.
They also recommend monitoring how those pre-authorization interventions are working. Which antibiotics are being requested for what conditions? And is the pre-authorization process causing any delays in treatment?
It's about striking that balance between ensuring appropriate use and making sure patients are getting the timely care they need.
And speaking of timely care, the CDC document also emphasizes the importance of reporting antibiotic stewardship data back to everyone involved: prescribers, pharmacists, nurses, and hospital leadership.
Transparency is key. Everyone needs to be in the loop about how the program is performing, what the challenges are, and what progress is being made.
Exactly. And they specifically recommend sharing information on antibiotic resistance, which should be prepared in collaboration with the hospital's microbiology lab and infection control department.
This helps raise awareness of those local resistance patterns we were talking about and guides prescribers towards more effective choices.
Now, data tracking and interventions are important, but we can't forget about the human element. The CDC document highlights education as a key component of any successful stewardship program.
Absolutely. We've touched on education throughout this whole deep dive. But I'm eager to hear the CDC's specific recommendations. Who should be targeted for these educational efforts? And what should those efforts look like?
So the CDC recommends targeting a wide range of individuals, including prescribers, pharmacists, nurses, and even patients and their families.
So it's about educating everyone who comes into contact with antibiotics.
Exactly.
From those who prescribe them to those who take them.
Exactly. And they suggest using a variety of educational approaches, including traditional lectures, online modules, posters and flyers, and even targeted messages through the hospital's electronic communication systems.
It's about finding creative ways to get the message across. And meeting people where they are. Some people might prefer a quick infographic. Others might benefit from a more in-depth lecture.
And the CDC specifically emphasizes the effectiveness of case-based education. Particularly when it's paired with interventions like prospective audit and feedback.
Case-based learning is a great way to make these kind of abstract concepts more concrete and relatable. It's one thing to hear about, the importance of choosing the right antibiotic. But it's another thing entirely to see how that plays out in a real-life patient scenario.
And by pairing those case studies with real-time feedback from the stewardship team, you can really drive home those learning points and help prescribers make more informed decisions in the future.
The CDC also recognizes the crucial role that nurses play in patient care and their ability to provide valuable education about antibiotics.
Nurses are often the ones who administer the antibiotics, monitor patients for side effects, and answer patients' questions about their medications.
They're on the front lines of care. So they're perfectly positioned to educate patients and advocate for appropriate use.
The CDC document wraps things up with a helpful self-assessment tool that hospitals can use to evaluate their programs.
A self-assessment tool, what does that look like?
It's basically a checklist of all the core elements that we've been discussing. It prompts hospitals to assess whether they have specific policies, procedures, and practices in place for each element.
So it's a way for hospitals to take stock of where they stand.
Exactly.
Identify areas where they're excelling and areas where there's room for improvement.
Exactly. It's a great resource for hospitals that are just getting started with stewardship or for those that are looking to enhance their existing programs.
This deep dive into hospital stewardship has really highlighted the complexity of the issue. It's not just about saying use fewer antibiotics. It requires a multifaceted approach that involves leadership resources, data tracking, interventions, education. It's been a whirlwind tour.
It's a constant process of evaluation and improvement. The bacteria are always evolving. Our understanding of antibiotics is constantly growing, and the healthcare landscape is always changing. So we need to be adaptable and willing to adjust our approach as needed.
Now, we've focused a lot on hospitals,
Right.
but Antibiotic stewardship is just as important in other healthcare settings,
Yeah.
like nursing homes.
Yeah. Let's take a look at the CDC's core elements of antibiotic stewardship for nursing homes.
Okay.
How does stewardship play out in that unique environment?
Nursing homes are a really important setting to focus on
Yes.
because they house a large population of vulnerable residents
Right.
who are at increased risk of infections.
Yeah.
Um, these residents often have multiple underlying conditions,
Right.
weakened immune systems,
Mm-hmm.
and they're living in close quarters with other people.
Exactly.
So the potential consequences
Yeah.
of inappropriate use are even greater in this setting.
Absolutely. And that's why the CDC stresses that the core elements of stewardship are the same for nursing homes as they are for hospitals.
It's all about commitment, accountability, drug expertise, action tracking, reporting, and education.
Those core elements seem to be a recurring theme
Yeah.
throughout this whole deep dive.
Right.
They're the foundation of any successful program,
Exactly.
regardless of the setting.
The CDC document provides specific guidance
Okay.
on how to apply those core elements in nursing homes, taking into account the unique challenges and opportunities of that environment.
Let's break it down, starting with leadership commitment. How does that play out in nursing homes?
The CDC emphasizes that leadership commitment needs to come from all levels within the nursing home,
Okay.
from owners and administrators to regional and national leaders.
Right.
If the facility is part of a larger corporation,
Mm-hmm.
they need to make it clear that antibiotic stewardship is a priority.
It's about setting the tone from the top down
Exactly.
and making sure that everyone understands that this is important. And that commitment can take many forms, from written statements of support to incorporating stewardship duties into job descriptions to creating a culture that promotes appropriate antibiotic use.
It's about making stewardship part of the fabric of the organization,
Yes.
not just an afterthought.
The CDC also highlights the specific roles that the medical director,
Okay.
the director of nursing,
Mm-hmm.
and the consultant pharmacist should play
Okay.
in leading and supporting antibiotic stewardship initiatives.
So it's about identifying those key individuals
Yes.
who have the authority and the expertise
Right.
to champion the program
Exactly.
within the facility.
And speaking of authority,
Yeah.
the CDC document also emphasizes the importance of accountability.
Mm-hmm.
It's not enough to just say that stewardship is important.
Right.
You need to have specific individuals who are responsible for making it happen.
So it's about having designated ownership of the program
Yes.
and ensuring that those individuals have the support they need to be successful.
Exactly. And the CDC also stresses the importance of engaging key partners,
Okay.
both within and outside the facility.
Who are some of those key partners
Nope.
and what role do they play?
Within the facility, key partners might include the Infection Prevention Program Coordinator,
Okay.
the consultant laboratory, and other members of the clinical care team.
Okay.
Outside the facility, partners might include state and local health departments or other organizations involved in infection control and stewardship.
It's about recognizing that stewardship is a team effort
Exactly.
and that we can achieve more
Absolutely.
when we work together.
Collaboration is key.
Yes.
By sharing data expertise and resources, these partners can help nursing homes implement more comprehensive and effective programs.
Another core element that the CDC highlights is drug expertise.
Oh.
Why is that so important in nursing homes?
Because nursing homes need access to individuals who have specialized knowledge about antibiotics to guide their stewardship efforts. These experts can help develop and implement policies, provide education to staff and residents, review antibiotic prescriptions,
Okay.
and ensure that antibiotics are being used appropriately.
So it's about having that go-to person who can answer those tricky questions about antibiotic choices, dosing, duration of therapy, and potential side effects.
Exactly. The CDC suggests developing relationships with infectious disease consultants in the community
Okay.
and ensuring that consultant pharmacists have training and experience in stewardship.
Those consultants can be a valuable resource for nursing homes, providing expert guidance and support for the program.
Now, in addition to leadership accountability and drug expertise, the CDC document also outlines specific actions
Okay.
that nursing homes can take to improve antibiotic use.
Let's hear about some of those actions. Where do they recommend starting?
They recommend starting with policies.
Okay.
Nursing homes need to have clear policies in place that support optimal antibiotic use.
Policies like?
Policies like medication safety policies and medication regimen review processes that specifically address antibiotic prescribing.
Oh.
These policies provide a framework for ensuring that antibiotics are being used safely and appropriately.
Okay, so they're laying the groundwork. Now what? What happens after those policies are in place?
They also recommend implementing broader interventions
Okay.
to improve antibiotic use across the facility.
What are some examples of those broader interventions?
One example is standardizing practices for evaluating and communicating about suspected infections.
Okay.
This helps ensure that everyone is on the same page when it comes to identifying and managing infections.
So it's about having a clear process for assessing residents who might have an infection
Right.
and for communicating that information to the appropriate members of the care team.
Exactly. They also suggest optimizing the use of diagnostic testing.
Because we don't want to be prescribing antibiotics based on a hunch.
Yeah.
We want to have evidence
It's-
to support those decisions.
Exactly. And they recommend implementing an antibiotic review process, also known as an antibiotic timeout, for all prescribed antibiotics.
Okay. We talked about antibiotic timeouts in the hospital setting.
Right.
But how do they work in nursing homes?
The basic principle is the same.
Okay.
It's about pausing treatment after a certain period of time
Okay.
or when new information becomes available
Okay.
to reassess the need for the antibiotic.
Okay.
It's an opportunity to make adjustments to therapy
Okay.
or to discontinue the antibiotic altogether if it's no longer necessary.
So it's a built-in checkpoint to help ensure that antibiotics are only being used when they truly need to be.
Exactly. And the CDC also highlights the importance of pharmacy interventions in nursing homes.
Okay. What do they mean by pharmacy interventions?
They mean integrating both dispensing and consultant pharmacists into the clinical care team.
Pharmacists have such a deep understanding of medications.
Right.
So it makes sense that they would play a key role in stewardship efforts.
Yeah.
What specifically do they recommend pharmacists do?
They recommend that pharmacists be involved in ensuring that antibiotics are ordered appropriately,
Okay.
that the selection is appropriate, that the dose, duration, and route of administration are all correct,
Right.
and that therapy is reviewed and adjusted or discontinued based on the latest information.
So they're really acting as antibiotic stewards, making sure that those medications are being used wisely.
Exactly. They can review culture data, develop antibiotic monitoring and infection management guidance, and really be a resource for the entire care team.
It sounds like pharmacists are the unsung heroes of antibiotic stewardship,
I think so.
working behind the scenes to make sure that these medications are being used responsibly.
Absolutely. And the CDC document also encourages nursing homes to focus on specific infections and syndromes that tend to drive inappropriate antibiotic use.
Okay. Give me an example. What kind of infections are they talking about?
One example is asymptomatic bacteriuria, which we discussed earlier. Remember, this is when bacteria are present in the urine, but the person isn't showing any symptoms of a UTI.
Right. And in those cases, treating with antibiotics often does more harm than good.
Exactly. They also suggest focusing on UTI prophylaxis,
Okay.
which is when antibiotics are used to prevent UTIs.
Gotcha.
In some cases, UTI prophylaxis is appropriate, but it's often overused.
So it's about being more selective with UTI prophylaxis and only using it in those cases where the benefits clearly outweigh the risks.
Exactly. Now, another key element of stewardship, regardless of the setting, is tracking and reporting.
Yes.
We need data to know if our efforts are making a difference.
Data is king, but what kind of data should nursing homes be tracking?
The CDC recommends monitoring both process measures and outcome measures.
Okay. Can you remind me what the difference is between those two types of measures?
Process measures focus on how antibiotics are being prescribed.
Okay.
They help you assess whether the stewardship program is being implemented as intended.
So it's about looking at the steps involved in antibiotic prescribing and making sure that those steps are being followed.
Exactly. Outcome measures, on the other hand, focus on how often antibiotics are being prescribed and what impact that prescribing is having on residents.
So it's about looking at the big picture,
Right.
the overall antibiotic use in the facility,
Yeah,
and whether that use is going up or down.
exactly. The CDC highlights the importance of sharing antibiotic use data in clinicians and nurses,
Okay.
so everyone is aware of the trends and can see how their efforts are contributing to the overall goal
Right.
of reducing inappropriate use.
Transparency is key.
Yes,
It helps create a sense of shared responsibility and accountability.
They also encourage nursing homes to use electronic health records to integrate pharmacy and laboratory data.
Okay.
This makes it easier to monitor antibiotic use and resistance patterns.
It's about using technology to our advantage
Right.
to streamline data collection
Right.
and make that information more readily available to those who need it.
And last but not least, education. We've talked about the importance of education throughout this deep dive, and nursing homes are no exception.
We need to make sure that everyone involved in resident care understands the importance of stewardship and their role in making it happen. Who should be targeted for these educational efforts in nursing homes?
The CDC recommends educating a wide range of individuals, including clinicians, nursing staff, residents, and even family members.
So it's about creating a culture of stewardship that extends beyond the healthcare team
Yeah,
and includes residents and their families.
exactly. And they recommend using interactive educational approaches like face-to-face workshops rather than just relying on passive methods like printed materials. They also suggest linking education with feedback on prescribing practices.
So it's not just about providing information. It's about creating opportunities for dialogue and feedback,
Yeah,
helping prescribers understand how their practices are impacting antibiotic use and resistance patterns.
exactly. And they emphasize the importance of engaging residents and families
Right.
in those educational efforts.
That's a great point.
Yeah.
Residents and families need to be empowered
Yeah,
to ask questions about antibiotic use
absolutely.
and to advocate for themselves.
Right, yeah.
They're a part of the team, too.
The CDC document wraps up with a helpful checklist for core elements of stewardship in nursing homes.
Okay.
It's a great tool for facilities to assess their programs, identify areas of strength,
Right.
and pinpoint areas for improvement.
It sounds like a great resource for nursing homes that are just starting out with stewardship.
Right.
Or those that are looking to take their programs to the next level.
Now, we've explored stewardship in outpatient settings, hospitals, and nursing homes,
Yes.
but the issue of antibiotic resistance is a global one.
Absolutely. It's a problem that we're all facing.
So let's take a look at how stewardship plays out in resource-limited settings.
That's a really important perspective to consider.
Yeah.
Antibiotic resistance doesn't discriminate based on geography or socioeconomic status.
Exactly. The CDC has a document called Core Elements of Human Antibiotic Stewardship Programs in Resource-Limited Settings, which provides guidance on how to implement programs in countries and facilities with limited resources.
I imagine the challenges are quite different in
Yeah,
those settings.
absolutely. They face many barriers, including gaps in policies and guidelines, limited training opportunities for healthcare professionals, inadequate laboratory capacity,
Right.
and scarce funding and resources.
So how do they recommend approaching stewardship in those environments? Do they just say throw the core elements out the window?
Not at all. The core elements are still the foundation of
Okay.
any successful stewardship program. But the document acknowledges that a different approach might be needed in resource-limited settings.
What kind of approach do they recommend?
They recommend a tiered approach,
Okay.
recognizing that different countries and hospitals will have different levels of capacity and resources.
So it's about meeting people where they are and providing guidance that's tailored to their specific situation.
Exactly. They outline 3 tiers of national-level antibiotic stewardship activities:
Okay.
basic, intermediate, and advanced.
Let's break those down.
Yeah.
What are some examples of activities at each level?
Basic activities are those that require minimal resources,
Okay.
primarily personnel time and access to technical expertise.
So it's about starting with those foundational activities that are achievable even in settings with limited resources.
Exactly. One key recommendation at the basic level is establishing a national committee or team
Okay.
to oversee antibiotic stewardship efforts.
This committee would bring together stakeholders from across the healthcare system
Right.
to develop a national action plan, coordinate efforts,
Yeah.
and provide guidance and support.
Another recommendation at the basic level is launching public awareness campaigns
Okay.
to educate the public about the importance of appropriate antibiotic use.
Those campaigns can help dispel myths
Right.
about antibiotics, encourage people to ask questions about their treatment, and promote responsible use.
And they also recommend adopting policies that require prescriptions for antibiotics.
Right.
This is a simple but powerful step to curb over-the-counter sales and promote more responsible use.
Okay, so those are some basic activities. What about the intermediate level? What kind of activities do they recommend there?
Intermediate level activities require a bit more in terms of resources planning and dedicated staff.
So these are activities that might be achievable once a country or a hospital has a solid foundation in place.
Exactly. One recommendation at this level is developing and ensuring access to recommended formularies.
Remind me what a formulary is again.
Sure. A formulary is basically a list of medications
Okay.
that are approved for use in a particular healthcare setting.
So in this case, it would be a list of antibiotics that are considered appropriate for use in that country or hospital.
Exactly. Having a well-defined formulary can help guide prescribing practices and ensure that the right antibiotics are available.
Another recommendation at this level is creating and promoting adherence to evidence-based treatment guidelines.
Yes.
These guidelines provide clear recommendations on how to treat common infections, helping to standardize care
Right.
and reduce inappropriate antibiotic use.
And they also suggest promoting diagnostic stewardship,
Okay.
which is all about optimizing the use of diagnostic tests to ensure that antibiotics are only being used when they're truly necessary.
That makes sense.
Yeah.
If we're not sure what's causing the infection, we might end up using antibiotics unnecessarily.
Exactly. Now, the advanced level activities are those that require the most resources and infrastructure.
So these are activities that might only be achievable in those settings that have already made significant progress
Yeah.
in terms of stewardship.
Exactly. One recommendation at this level is enforcing those policies,
Okay.
requiring prescriptions for antibiotics.
This might involve penalties for non-compliance or incentives for adherence, making sure those policies have some teeth.
Another recommendation is tracking antibiotic dispensing, using available data and setting national targets for improvement.
So it's about gathering data on antibiotic use, analyzing those data,
Yay.
and setting ambitious but achievable goals for reducing inappropriate use.
They also suggest measuring antibiotic consumption, which involves collecting patient-level data to track how much antibiotics are being used
Okay.
and whether those antibiotics are being used appropriately.
This requires a more sophisticated data collection system,
Right.
but it provides valuable information on actual antibiotic use patterns.
Another important recommendation at this level is characterizing resistance patterns
Okay.
to improve treatment guidelines and identify priority pathogens.
So this involves conducting surveillance to track the emergence and spread of these resistant bacteria.
This information can be used to inform treatment guidelines and prioritize efforts to combat those resistant strains.
And they also recommend monitoring antibiotic quality,
Yeah.
which I imagine is especially important in resource-limited settings,
It is.
where counterfeit or substandard medications might be a concern.
It's about ensuring that patients are receiving high-quality medications that are effective and safe.
Now, in addition to those national-level activities, the CDC document also provides guidance for hospitals in resource-limited settings on how to develop and implement those programs.
Exactly.
That's great. So even in those settings with limited resources, hospitals can take steps to improve antibiotic use. What kind of guidance do they provide?
They recommend starting by establishing those foundational structures and processes,
Okay.
identifying target priorities, and then taking action to address those priorities.
It sounds very similar to the approach we've seen in other settings.
Right.
Start with the foundation,
Right.
figure out where you want to go,
Yeah.
and then build from there.
The core principles of stewardship are the same regardless of the setting,
Yes.
but the specific strategies and interventions might need to be adapted to fit the local context.
The CDC document highlights the importance of having a single point of contact.
Yes.
Who's responsible for the program, and ensuring that the program has support from hospital leadership.
Yeah, absolutely.
Those are those key foundational elements that we've talked about before. You need someone who's championing the program and who has the authority and the resources to make it happen.
And once those foundational elements are in place, they recommend taking a stepwise approach to building the program.
Okay.
Starting with the formation of an antibiotic stewardship committee,
Okay.
identifying a priority area to focus on, and then implementing specific interventions to address that priority.
It's about starting small, focusing on what's achievable, and then building from there as resources and capacity allow.
They provide a helpful table outlining a range of stewardship activities
Okay.
and their resource requirements,
Right.
helping hospitals choose activities that are feasible for their setting.
It's about being resourceful and creative, finding ways to make stewardship work, even when resources are tight.
And they also emphasize the importance of monitoring and evaluation, even in those settings where data collection might be challenging.
Right. It's important to track what's happening, to see if the program is being implemented as intended, and to assess whether it's having the desired impact.
Exactly.
It's a continuous quality improvement process.
Yeah.
This CDC document provides a really valuable roadmap
Right.
for hospitals in these resource-limited settings, demonstrating that even with limited resources,
Yeah.
they can take meaningful steps to improve antibiotic use and combat resistance.
Now, this deep dive has taken us on quite a journey through the world of antibiotic stewardship.
Yes.
We've explored a lot of ground, from outpatient settings to hospitals to nursing homes to resource-limited countries.
Absolutely. We've covered a lot of ground today.
We've covered the core elements of successful programs, delved into specific strategies and interventions, and emphasized the importance of leadership commitment, data tracking, and education.
It's been eye-opening to see just how pervasive this issue of antibiotic resistance is,
Yeah.
affecting every corner of healthcare in every region of the world.
It's a sobering reminder that we can't afford to be complacent about this issue.
Antibiotic stewardship is everyone's responsibility.
Yes, it is.
Whether you're a student hitting the books, a clinician on the front lines, a pharmacist dispensing medications, a healthcare leader setting policies, or simply someone who cares about the future of medicine. There are things you can do
Yes.
to promote responsible antibiotic use. Stay informed, ask questions, challenge the status quo, and advocate for change.
I love that. If you enjoyed this deep dive into the world of antibiotic stewardship, we encourage you to like this episode, subscribe to our channel, and share it with your friends and colleagues.
Yes.
Let's spread the word and make a difference together.
Absolutely. Thanks for joining us.
Thanks for having me.